Hey everyone, welcome back to Therapist Uncensored. I'm really excited about our guest today. I get to have a delightful conversation with Diana Hill. She is the podcaster of Wise Effort, an author, educator, and psychologist, clinical psychologist, correct?
Correct.
Well, and I got to meet you as a being on your show, which was such a delight, and got exposed to so much of the way you think and work. And I got so excited I wanted to have you on. So I really appreciate you coming on with us today. Welcome.
Thank you. I keep a few books right in my office, and for my clients, sometimes get a view of them, and yours is right there. I'm looking at it right now. Is
Oh,
one that I pass to my clients all the time because it is so phenomenal. And I was
oh,
so
thank
grateful to have
you.
you come on the Wise Effort show and talk about relationships and this really, truly beautifully integrative approach that you have.
Well, thank you
So,
so much.
yeah.
I really appreciate that. Well, talk to me like you have so many different facets to you. One of the things I'd like to do though is to start with ACT, if we could, because you are a trainer in ACT and work directly with boot camps, etc. Can you tell our listeners what is ACT?
Well, ACT it's under the umbrella of a cognitive behavioral approach, but it's so much more than that. And anyone that learns or experiences ACT, some of the things that they say that really stand out about it are its focus on values. So it's
Hmm.
focused on helping you identify what's important to you, how you want to be in the world, and then all the obstacles that show up when you try and pursue those values, what to do with them. So the obstacles of your thoughts, or the obstacles of big, strong emotions, or the obstacle of your sense of self, your identities of not like the I ams in the world, right? And ACT is about psychological flexibility. So developing your capacity to be flexible enough to move through all those internal obstacles and continue to pursue what you want to pursue in life and be the type of person you want to be in life. It applies to all sorts of things, your parenting, your relationships, but they're also using ACT in places like with Olympic athletes. They're using ACT with people that are severely depressed or anxious. It has a lot of different ways that it's used, but it really sort of is attending to the fundamental aspects of our human nature.
And what gets in the way of our fundamental aspects of human nature. And
Yeah.
I guess I should have started off with so ACT stands for acceptance and commitment training, right? And
Yes.
so the idea of having it centered on values, I think, is very, very intriguing because sometimes it is our values that can even get in the way. This is who I think I am, but this is who I'm being. And sometimes those don't match up, right?
Yeah, that's a lot of times what people come into therapy, right? That
Right.
discrepancy.
Hmm.
Because when you're acting in a way that doesn't align with your values, it doesn't feel good. I mean, you feel regret,
Yeah.
you feel remorse. You may even try and hide that from your own self, right? I don't want to look at that part of me. And it's actually those moments of discrepancy that can be real guides for us in terms of looking at how do I want to be, and why am I not doing, like, why is it so hard, even though I know that I love my partner and I want to be close to them, but it's so hard to take their perspective when I'm fighting with them in the kitchen, right? And
Right.
how could I actually do that? Like, what are the obstacles and barriers, and what are the skills that I need to make that happen?
I love it. Tell me all about that because sometimes I'm standing in the kitchen and I know what to do, but I don't always do it. And so, and I think that we could all relate to that. So
I
how
Yeah.
how does ACT, how do you help people walk through the acceptance and commitment part of the training?
Okay, I think it's best to give examples from our own real life examples. I use the kitchen
Okay.
because the kitchen, I feel like, in my household is where everything goes down.
So I completely relate to that. So I can't wait to hear more. Standing in the kitchen and I know how I want to be, but that's not what I do. And it can be so frustrating.
Yeah, so with ACT, there's these processes. There's six of them, and they're sort of like sides of a Rubik's Cube. They all interact with each other, right? So if you work with the red side of a Rubik's Cube, it's going to impact the blue side, but it's helpful to separate them out. And these processes give you a little bit of insight into what's happening in that kitchen when maybe you're psychologically inflexible, right?
Mm-hmm.
So one thing, for example, with my spouse, when I'm in the kitchen and in a fight with him, one process that can get in the way of me securely relating to him may be something like my thoughts, right? And we have thoughts going on all the time. And a lot of the time, what happens with our thoughts is that we're so entangled in them. We're so wrapped up in them that we actually can't see them. We can't see them clearly. And in traditional cognitive behavioral methods, we would do things like, let's challenge those thoughts. Or is that I remember when I was in graduate school, they'd pass me the sheet of paper, like label it. Is it catastrophizing or is it overgeneralizing? And I would like struggle, which is which?
It's both.
It's both. It's all. I don't know.
All of them.
Yeah. So with ACT, we don't do a whole lot of that.
Mm-hmm.
What we do is help people get a little bit of space. Mm-hmm. Notice your thought. Is this a helpful thought? Is this not a helpful thought? Can you let the thought pass on through? It's very kind of consistent with Buddhism, the approach with thoughts. We don't battle thoughts. We don't challenge thoughts. We just let thoughts go, and we can act independently from our thoughts. So that may be one thing that's going on. Your thoughts may be part of the reason why you're struggling in that moment with your kitchen, in the kitchen with your spouse. And it may be thoughts about them, thoughts about yourself, or you're just distracted,
Or maybe your thoughts aren't present. And yeah, that's part of the problem. I think noticing your thoughts sometimes is the hardest thing, right? Because we feel it. We feel the action so fast. It's so hard to even realize that we're having a thought that we're acting on.
Yeah. Slowing down to notice your thoughts. I mean, even as we're having this conversation and you're having thoughts going on in the background, I'm having thoughts going on in the background, the listeners are having thoughts going on in the background. Some of them may be related to what we're talking about. Some of them may be totally unrelated. So with ACT, we're helping you get a little bit more skillful with all of these thoughts that are just sort of bouncing around in your head, right? Which ones are helpful, which ones are not, which ones do you want to pay attention to? And that's a process that's called cognitive diffusion.
Okay.
So that's one thing in your kitchen. Another thing that's going on in the kitchen is that you're, as you just mentioned, like sometimes you're just so flooded by your emotion that's what's running the show. You're overwhelmed by what you're feeling. There's a lot of anger, or there's a lot of fear, or whatever it is, that anxiety that's happening in that moment. And you don't know what to do with it, or you're trying to suppress it. And with ACT, we teach a skill called acceptance. How can you be there? Like notice that you're having a feeling in your body. Where is it in your body? Can you make space for it? Sort of like, I don't know, if you were to take like a dropper of ink and drop it into a glass of water, that's how it feels. Like it completely colors your experience, versus if you drop a dropper of ink into an ocean, there's more space for it, right? So there's a whole slew of skills, and we could even do some of these together, but of practicing acceptance of whatever's showing up, like anger, fear, naming it, feeling it, making space for it. That's another thing that we could do in the kitchen. But then there's still 4 more.
Okay.
There's getting present, like actually how can you like land and get grounded in the moment, be there with your partner. There's your sense of self, expanding your sense of self. Like, I know you're a fan of Dan Siegel. So there's not just you and me, there's a we, right? There's an expanded self. And in our house, we call it the family body. Like I'm one arm, we have 4 people in our family. So like I'm one arm, he's one arm, one kid's one leg, the others. And it was like, how's our family body doing? Right.
Oh, I love that.
Because we all help each other out. Like we need both arms to clean up the kitchen after dinner, and, the whole family interacts. So expanding that sense of self beyond just me and you, which is a really useful tool. And ACT, they call it, sort of the transcendent self, or maybe even practicing some more perspective taking. And then with ACT, there's also the practice of your values, like remembering in that moment, I remember that I love this person, even though I hate them right now, or I'm having the thought that I hate them, and remembering how is it that I want to show up. If someone were videotaping me right now in my kitchen and they were posting it, would I feel good about that? Is that how I want to be? Is this how I want, is this when, if this were the last time that we were in a kitchen together this way and something happened to them tomorrow? Is this how I'd want it to end? Right? So
Wow.
getting
Yeah.
clear on those kinds of bigger picture values things. And then finally, committed action, which is carrying out the actual behavior. So
Mm-hmm.
that's where ACT becomes this behavioral psychology. Like we
Mm-hmm.
still use the behavioral principles, but in a much more flexible, fluid way. And,
Mm-hmm.
like there's things to do here. There's ways to communicate more effectively. You shared on my
Mm-hmm.
podcast, use sentences, not essays, right? That's a
Right.
behavior that would really help you
Mm-hmm.
out in this moment. So we
Mm-hmm.
we use a lot of behavioral science to help you with that committed action. And it boils down to these six, I'll just repeat them all because we'll
Yeah. Yeah.
span all of them. But the
And we'll go
six
with those.
core processes, the six sides of this Rubik's Cube are: one, stepping back from your thoughts, cognitive
Mm-hmm.
diffusion; two, acceptance, making
Mm-hmm.
room and space for everything that you're feeling without getting entangled in it and without suppressing
Mm-hmm.
it; three, get present;
Mm-hmm.
four, practice perspective taking or expanding yourself; five, remember your values; and then six, take committed action. Do something, or sometimes don't do something,
Or
because
don't do something.
that's
Yeah.
the committed action.
It means close your mouth.
Yeah.
It might even just
Sentence.
mean a sentence, not every feeling that gets thrown to your body that you need to act on.
Yeah.
I love that. I
Okay, I'll
love it. Yeah.
stop my
So
essay now.
I love it.
Point
No, but
essay.
that way we have this concept. Let's walk through. Let's go back to the kitchen because, I mean, so one of the encouragements in this is a lot of. I love that you were able to use that you integrated secure relating because that's the way my mind thinks, right? But it is finding it's these steps to help you move into your more secure present self
Flexible
and
self.
flexible self. Yes, that's wonderful.
Mm-hmm.
So, sometimes it's easier said than done, though, right? Like, to be able to remember, to take a perspective, or to recognize your thoughts. So, How do you help people remember this process and go through it? So, can we go back to the kitchen and I'm having a fight with Sue and
Right.
I'm standing in the kitchen and I'm really feeling misunderstood, right? Like something was said and I just am shocked and it's just so wrong and I feel really misunderstood and now I can tell I'm mad and a little anxious.
Mm-hmm. Well, you used a kind of important line there, which is how do we help people remember? And
Mm-hmm.
I'm a big believer that we remember through embodied practice. So
Yes.
so please don't be in your kitchen trying to think about those six things. I remember she said six, and I don't remember which one I should use right now. Right. So I really do feel like ACT is best learned through embodied practice, and that's why
Mhm.
I lead workshops in it, or do a lot of actually lead retreats in this stuff where like people come with me and we practice it, and we live it, and in that moment you said like I'm feeling really misunderstood,
Mhm.
right? So so first is would my go-to there would be like, okay, this is a get present moment because you're having a feeling. We need to slow this way down. I'm feeling really misunderstood here, and pausing in that for a little bit, because what happens is when we're feeling misunderstood, we may do all sorts of inflexible things, right?
Right.
Um, I'm feeling misunderstood, so therefore I'm going to close off from you. I'm not going to actually take your perspective. Or I'm feeling misunderstood, so I'm going to, do all the unsecure relating things. I'm either going to shut down or I'm going to go towards, right? And the slowing down to I'm feeling misunderstood, maybe there's something about being understood that's really important to you.
Mhm.
So we slow down, and when we're hurt, we also have a really clear direct arrow to what our values are.
Mhm.
So when I'm working with a client, I'm looking for two things. Like I'm looking for where are they hurting? Where are they hurting as an arrow to their values?
Mhm.
And then what brings them vitality? Because what brings you vitality is an arrow pointing to your values. So if you're feeling misunderstood and you slow down and you notice that, and then you feel that and you remember, oh, I hurt where I care, then you can
Mhm.
actually flip it and start to say like, oh, I care about being understanding.
Mm. Mhm.
And then now you have something to work with. Like maybe I could practice that value.
Of being understood. So in that context, if I'm centered on my experience of being misunderstood, which could leave me and tempt me to try to stop the whole thing, because obviously your partner wouldn't be having that feeling if they just understood, right? If they just
Yeah.
if they just didn't misread or misunderstand.
Mm-hmm.
And so there's a temptation just to stop everything and explain.
Mm-hmm.
And what you're suggesting is like to really think about the feeling of being misunderstood and the value that that represents for me.
The value that represents for you,
Mm-hmm.
and actually how you could live out that value yourself.
Mm-hmm.
Could
I
you
love that.
practice being understanding to yourself? Could you practice being understanding to your partner?
Right.
And notice I didn't say, could you make your partner understand you more?
Right.
Because
Because that's a temptation, right? If
that's
they
the
could just
trap.
all they have to do is understand more and they wouldn't be mad in the first place, right?
Yeah.
So, yeah.
Yeah. Yeah.
So you
So that
flipped
would be a
it.
simple, yeah, that would be a simple thing of like pausing, slowing
Right.
down. What's hurting here? What are my values? And how could I act on those values in this
Mm-hmm.
moment?
Mm-hmm.
And that's where values are different than needs in a relationship. Because actually, you really do need to be understood by your partner,
Right.
but you have less power over that
Mm-hmm.
than you do over you being understanding.
Mm-hmm.
And it'll actually probably increase the chances of your partner meeting that need for you.
Wow. You just like I really felt that as you walked me through it. And you're right. To probably one of my top values is to understand, is to be understanding. And so as you mentioned that, I'm like, oh, that really hits a deep part of me. It's just not this moment. It's a deeper part of my internal sense of self, my core self of being understanding. And
Mm-hmm.
so now I'm acting on my value
Mm-hmm.
of if that's so important, can I be understanding why he or she's angry in this moment
Mm-hmm.
and
It's really
care?
empowering.
It really is.
Mm-hmm.
Yeah.
And I like how you're using that as a verb, being
Mm,
understanding, because in ACT values are verbs and adverbs
mm,
describing our ways of being. And I did this workshop with a bunch of executives once, and it was like they had like pre-printed the journals, and on the journals ahead of time they said like write your 3 core values down, and then they like slapped them on the journal. And I went in to do this work. I was so excited, so jazzed to talk about values, and they were like, we already know our values, they're on our journals. And I was like, well,
like each person wrote their own
yeah, yeah,
value
yeah.
on.
But we kind of get a little rigid like that. Like we think like
Yes.
my value is understanding, being understand, or to understand. But values are much more like it's good to have a sense of like what your core values are, what your top values are. But I would say values are kind of even more flexible and fluid than that. Because in this
Right.
situation, it may be that the value that's floating to the surface is I really care about being understanding and being understood, and how could I act on that right now. And in another situation, it may be another value that's floating to the surface, right?
Mm-hmm.
And
Mm-hmm.
the attunement to listening to the care inside of your body is that attunement that will help you know how to live from that place of care, from that place of valuing the verb, and how you could actually do it behaviorally.
That's really, really powerful, Dana, because it's like this. I love what you're saying. If you just put the 3 values that you think are top in your mind, they may not be what you're embodying in that one moment. Like, I don't think there's any way. I mean, yes, I value being understanding, but that's not what would hit the top of my journal, right?
Yeah.
I would never think of that, right? There's all sorts of things that would come to top of mind because when you think of values, there's such another way that we perceive of values. But what I hear is that we're tuning into what is creating these deep feelings in us and then going deeper to study why that's so important and then acting on that value.
Yeah.
Yeah, that's really deep. Mm-hmm. And so
When
when tell me something. You have the journal. Can you tell us a little bit about the journal? Because I think that is a really important part of this process is to be able to take note of these things that come up for you, for each of us.
mm-hmm. Well,
In
the journal's a guided one. I'm a fan of journaling, and I've also found, and there's some research to support this, that if you sometimes if you turn your journal into a complaining device, you can get deeper and deeper into your story. And so
Yeah.
this is a guided one where I focus with folks on one process at a time and kind of stepwise moving through that process in their life. Like, where and with whom do you want to be more present in your life?
Mm-hmm.
Gosh, you could just journal on that for a little bit, and
Oh,
that
yeah.
may shift how you approach your day, right? When you
Right.
get kind of clear on that. But or something like with values, looking back on your life, what do you most regret?
Mm-hmm.
And there was actually a study from Daniel Pink, he wrote the book Power of Regret, and I interviewed him a while back about this concept of regret, because regret's another one of those things we don't want to think about, but it actually tells you a lot about
Right.
what you value when you actually look at your regrets. And he, from his study, it was over, I think, 2,000 people that he did this American regret survey. You can actually go online and find it, and it on the survey, you can like read people's regrets from the state that you're in. It's kind of fun to read other people's regrets. But he categorized them into these 4 categories, which were like foundational regrets, the things that build up over time. Like, I regret all the tanning beds that I did when I was in high school, college. And then, there's boldness regrets, the times that we
Mm-hmm.
didn't say something, we didn't step out, we didn't, call out a microaggression. We weren't bold in some way that we need to be bold. And then there's connection regrets, like those relationships that we let rift. The rift
Mm-hmm.
just kind of kept on going, or that high school friend that you never kept up with.
Mm-hmm.
Um, and there's moral regrets, the ways in which we've harmed ourselves or other people. And I'll do this in workshops where I'll have people write down on one side of the paper a regret.
Mm-hmm.
And then I'll tell them, because I'm not going to make you share your regret, because people write all sorts of things on that, like
Right.
the
Right.
affair and but write on that regret, down the regret. And then on the other side, flip it over and tell me, this regret is so painful to you because you care about something. What is it that you care about that makes you regret this?
Mm-hmm.
And so the person that had the affair may say something like, I care about honesty. Or the person that, was drinking for years and years, I care about my body.
Mm-hmm.
I care about taking care of my body. And then once you have that care, because you flipped your paper over,
Mm-hmm.
then I say, now, guess what? You get to work on that regret in the here and now by acting
Mm-hmm.
on that value. You heal your regrets by how you act today.
Mm-hmm.
And it's actually exposing that, and kind of looking at those places within ourselves that we don't want to look at, to kind of dig for the care. And that's what helps guide us in our valued action. So that's really what ACT has, a lot of ways of doing that. But you can get creative, whatever your approach is that works for you, whether it's journaling or, in therapy or other places.
Well, with the acceptance part, that can be the hardest, right? Like like, I think about regret also as a way of reviewing that past thing and making it almost as if it didn't happen, because I keep regretting it. As long as I keep it actively in
Mm-hmm.
regret, there's a
Mm-hmm.
way we suspend the reality of how we didn't act on our value. So if we just keep living it over and over and over again, by living in our regret, we don't have to really accept it. And
Yeah.
the way that you're putting, it's like, hey, wait, turn it over. What is it? What is the value it's representing, and bringing it in the present? There's a deep sense of acceptance that we do fall short of our values sometimes. It's just reality,
Mm-hmm.
but that then you're bringing us really into the presence of how to act on that value now. There's something we can do about it, but it's only in the present, not in the rehearsing of the past.
Right.
Yeah.
Thich Nhat Hanh would, he'd say, we heal the past, and we
Mm-hmm.
create the future
Mm-hmm.
in the present moment.
In the present moment. Mm-hmm.
So not
Mm-hmm.
only are you healing the regrets by accepting
Mm-hmm.
with compassion, but you're
Mm-hmm.
also planting the seeds
Mm-hmm.
for what you're growing in your future.
Mm-hmm.
And that the image of the kitchen with my spouse, um, the past couple of years, we've been going through a health condition with him where he,
Mm.
about 4 years ago, I went up to the kitchen and he was like, I can't see a big portion of your face.
Oh,
Can't see your
wow.
eye. I can't see your cheek. And many trips to UCLA later, he was having this really kind of rapid vision loss. And he started doing this thing when I just the image of him in the kitchen where we'd be in the kitchen together and he'd start tilting his head like a bird from side to
Mm-hmm.
side and up and down so that he could see my whole face.
Oh.
And he started to do this, bringing up regret. I couldn't look at him when he did that. Like I hated it so much that he had to do all of this head tilting because it was so painful for me to feel like he couldn't see me in the same way that he's seen me for 25 plus years, right? And so I
Right.
started like avoiding looking at him. And that's what we tend to do. Like something painful shows up and we engage in an act, they call it experiential avoidance. Like we don't want to accept that thing. And as we are avoiding the pain, we're also moving away from our values, right?
Right.
So as I'm avoiding looking at him, I'm also not being supportive or close or actually even savoring the time that we have together that he can see my face, right?
Right. Right.
So this is where psychological flexibility and ACT comes in because we start to notice that, ouch, this hurts. Oh, I'm avoiding. What are my values here? And how can I turn towards the thing that is painful to me, have enough space for it, have the courage to be with it because I care enough to do that? And then how can I make space for all the thoughts that are going on and all the stories that I'm creating that aren't here? Because let me tell you, our minds go like 10 years into the
Right.
future about where this is going to be, not right here and right now. And that requires a tremendous amount of psychological flexibility to do. So it happens all the time for all of us. And the question is, how do we get back on track here and be flexible enough so that we can see, oh, this moment of avoidance is
Mm-hmm.
pulling me away from how I really want to be with somebody.
Right. And really pulling you away from you, right? You're avoiding the sadness that
Mm-hmm.
also brings to see the difference in him, right? So you
Yeah.
moved away from him and you in that journey and the value of being present with yourself. And but that's a hard thing to recognize and stay present for, isn't it? Are those things that are painful and that we want to pull away from. It's like we put our hand on a hot stove. Our instinct is to yank it back and to not go back. And yet there's so much in our life right now that does create so much discomfort and pain and fear. And staying present with that is not easy.
Mm-hmm. It's not easy. And I think everyone has had the experience of, maybe, hopefully, of some of the miracles that can happen
Mm,
when you turn towards that thing that you don't want to turn towards, right?
right.
Especially if you do it in a really loving way. Like not in a, now I need to look at this and like start,
Right.
unpacking my trauma today. Like it's more of like, oh, like there's something here. I think
Mm.
there's a Mary Oliver poem that sometimes I'll use as a prompt, a writing prompt for folks in workshops, which is in the night I dreamed this poem. Somebody I loved once gave me a box full of darkness. It took me years to understand that this too was a gift. And then I'll have
Mm,
people write out, it took me years to understand that this too was a gift. Finish it out.
hmm.
And what, whatever your box full of darkness, for us right now, it's this, but we've
Right.
had other boxes full of darkness in our relationship and we'll have plenty more. And not in a, like shoving post-traumatic growth down somebody's throat way, but more just like there is something here
Hmm.
that actually when I can turn towards my husband and see his tilting head and then see his sweet eyes that are just like, I want to look at you. I'm like, oh, this is actually good. There's like some good stuff in there. And
Yes.
some ways in which we've gotten closer
Uh huh.
because of this pain. And everyone
Right.
has that, like
Right.
different experiences they've had in their life.
Mm-hmm. Mm-hmm. And to see the sweet face, how hard he was working to see your face, how
Mm-hmm.
important it was for him to see you and to be there with you. That's
Yeah.
really powerful. And to miss that, if you avoid the pain of it, you miss those sweet eyes and his efforts to do it and your pain of the differences with him. And I can imagine by seeing the gift in that. And like you said, in the moment you might pull away. So in this process of ACT, it's coming back to that moment and feeling that regret. And then I think what you're saying is then finding the value and living and moving towards that value in the present.
Yeah.
Mm-hmm.
Yeah. It's looking for the things that we're making wide circles around. You
Yeah.
know? And as therapists, this is what we're doing all the time, right? Like,
Right. For sure.
wow, you just made a huge circle around your mom. Like, how are we talking about Home Depot right now when we were just, like we see the avoidance strategies,
Mm-hmm. Mm-hmm.
whether we're avoiding it because we're not talking about it, or we're doing all sorts of other avoidance things that cause us, secondary problems in our life, like our substances or our phones or, all the ways in which we avoid discomfort. So with ACT, we're looking for those. Those are
Mm-hmm.
signs of psychological inflexibility. And then we're also looking for the things that we're attached to. We're gripping on too tight.
Mm-hmm.
And
Mm-hmm.
and maybe I'm gripping on too tight to everything staying the same. Like that's a big one.
Right.
Or an identity, or, gripping on too tight to, like, he needs this, or he needs to be this, or I need to be that. Right.
Right.
And that the more that, in Buddhism, they call it the four worldly winds, the winds of change, that every, you have a wind of praise and success, and then you have a wind of loss, and then you have a wind of pleasure, and you have a wind of pain. And the one guarantee is that these winds will blow through your life over and
Mm-hmm.
over again. They blow through. And if you try and avoid them, or you try and hold on to them, you're going to have a pretty wild storm. So the capacity to be with those winds, to stay grounded in the present, and then to keep your heart open enough to know and feel the values that you want to focus on here.
And I guess that is a deep part of the acceptance, isn't it? Because we want to control it. We want, if we're having an amazingly positive experience, we want to hold on really tight, or a negative, we want to avoid it. Although for some of us, we avoid the positive because we know the negative's coming, right? Like, I'm not going to even look over there because I know it won't last. There's so many different ways that we can manifest that avoidance, isn't there? Or to move away from acceptance. And so the acceptance of the negative, that it will flow through you. It won't stay there, but neither will the positive. And how do you help? Are there anything specific that you can share with the audience about how you help people move through that kind of an acceptance of the winds of change?
Yeah, sometimes I like to think of, like, body-based ways, mind-based
Mm-hmm.
ways, and behavior-based ways. So body-based ways are, before I trained in ACT, I trained in DBT. This is like the evolution of many therapists, But I remember I actually got a chance to train with Marcia Linehan. I was on a research study. My graduate work was in working with eating disorders and using DBT for eating disorders, and I trained with Deborah Safer at Stanford, and she had me come and go into some of these little research rooms with Marcia, like they would have like a summer research thing, and
How
one of the
exciting.
things that super cool. But one of the things that Marcia would talk about was like willing hands and a willing face, right? And we can all do this right now. Like, the difference between crossing our arms, pulling our shoulders up, drawing our belly in, kind of like scouring down, like, how open am I right now to this moment?
Yes,
and
yes.
and we know that our body sends signals to our mind just as much our minds, the vagus nerve, all that's happening, right? So we can do that. And then we can also take this long exhale and let our shoulders drop and our hands drop, and, have our face reflect with loving eyes, or openness to what's
Right.
here. And that in itself is a practice of acceptance. I'm accepting with my body,
Mm-hmm.
right? And then we can accept with our minds, which is, we're both kind of friends and fans of Dan Siegel.
Yes.
I used to do this with my kids all the time, the yes brain, right? So I would say things, we could practice these kinds of things where, with my kids, I do this, but sometimes I'll do this with clients. I'll say in your head right now, you can do this with me, Anne. Say
Okay.
in your head right now, no to everything, every question that I ask you. Okay.
Okay.
Do you think this interview is going well? Do you want to ask another question? Do you think this will be helpful to the people that are listening? Do you want to have like a conversation with me after this sometime? Okay. Now, notice how that felt.
Wow. Yeah. I
Yeah.
felt it every single, it was making me so uncomfortable, especially the part about conversation. Because I'm like, of course I
Yeah.
do. but
Okay.
I could really feel how it blocks me. That the
Yeah.
no, I could feel I even felt my body getting tense and wanting to pull in.
Yeah. Now
Yeah.
let's do it with you now saying yes. And this isn't saying yes to things that you don't want to say yes to, but
I'm
just
with you.
a yes mind. Um, do you think this conversation is going well?
Yes. I know
Do
it's
you
supposed to
think
be my mind, but
in your mind, do you think this could be helpful to some of the listeners? Right? Do you want to have a conversation about this afterwards? Right? How'd
Mhm.
that feel? How was that different?
Oh, remarkably different. My whole body's calm. I feel connected to myself and to you. Feel open. Feel more. I became more aware of the audience in a positive way,
Yeah, because they're
in
here
an
too.
openness, in the expansive way that we're all part of the one conversation together.
Mhm.
Mm-hmm.
Yeah, we're thinking about them. They're here, they're
Yeah,
included, and there's a
exactly.
yes to that. And the yes is, again, it's not saying yes to things that you don't want to say yes to, but it's more of the aspects of acceptance that are the word acceptance. The root of it means to receive.
Mm-hmm.
So it's saying I'm willing to receive what is. I don't have to like what is. I don't have to approve of what is, but I'm willing to receive it so that then I can actually, do something here
Mm-hmm.
about it. And so even words like allowing or welcoming or being open are other words that we can use for acceptance. So that's an example of a mind-based one. And then a behavior-based one for acceptance is acting in a way as if you were accepting. So if you were
Right.
fully accepting of your husband's vision loss, what would
Yes.
you do? Well, I'd look at
Wow.
him. So even if you're not there yet, sometimes you can behave your way into things before you even are fully on board, because we know that our behavior feeds into our
Mm-hmm.
minds and our bodies as well.
Mm-hmm. Mm-hmm. It's so interesting as you express that. The word, for some reason, that I connected to that has been a shift for me in the last few years in acceptance in all of those realms is the idea of privilege.
Mm-hmm.
Like that my kids using that word used to feel really threatening to me. If they identified something that we're privileged or I'm privileged on, and I could feel the threat in it and the resistance and the desire to push it away. And over the last however many years, I've grown to my whole body has opened to what that really means. And it's broadened me and it's helped me feel more connected to that part of my life without the resistance to it. And so, for some reason, that came to mind when you were saying if I was really accepting of the privileges that I've been given in life, that doesn't mean I'm giving up all the hard work I've done or the hard knocks I've had. It just really means I'm accepting this moment of what I haven't earned that I have.
Yeah.
And for some reason, that's what came to me immediately is that acceptance brought so much openness to me and more curiosity and more desire to know more. It was the opposite feeling.
And what I would wonder
Yeah.
about with that is have felt something similar in terms of privilege and looking at my whiteness or looking at
Right.
all the privileges that I have.
Mm-hmm.
That discomfort that you're experiencing may also point to your values.
Mm.
That it may be that you're uncomfortable with looking at privilege because there's actually something there in terms of, oh, I actually value equity.
Yes. Yeah.
And so opening up to privilege actually can help you act more from a place of working towards equity. And that's the kind of like, what? Whoa,
Oh, it's so
kind of
true.
mind
Yeah.
blowing thing, right? Like and so this is where, when we have that capacity to go to the places that are uncomfortable and stay there a little longer, open up to them, look at them, what's going on here, rather than just like, oh, I don't like that word privilege, so I'm just going to like try and be, I don't know what,
Right. Or try to
rigid and
shut down the
perfect.
conversation
Shut
or
down the
stand.
conversation. Yeah.
You think you don't talk about privilege. Let me tell you about my history.
Yeah.
Like, I mean,
Well,
and I
yeah.
get it. Like, I get it. Right. But you're right. It's like, if I really look at the value that that's representing, instead of resisting and being in my defense, I can open up and then, oh, yeah, I do value that. And so that but it's hard, right? Because sometimes you open up values and then you see any consistency between that value, then shame emerges. In what
Mm-hmm.
ways are things never going to be equitable? Like, how do you deal with underlying shame sometimes as you really look at the value that you're identifying and the ways that you're falling short?
Yeah. And that's why there's all these other processes to help with this. Like,
Right. Yeah.
shame shows up. So then maybe I could step into, we could work with self here.
Mm-hmm. Say more.
Is there a bigger self?
Mm-hmm.
Like they could hold some of that shame and help me with it, a compassionate self.
Mm-hmm.
Or is there, we're working with acceptance, or working with all the thoughts that are kind of triggering the shame. Can I
Right.
ask myself, are you sure? With some of
Mm-hmm.
those thoughts, is this a helpful thought? Or, all sorts of things. But it's yeah, there's a lot to unpack
Mm-hmm.
with
Mm-hmm.
getting
Well, and
psychologically
I think
flexible.
that's also then the question of, how do I show up? Like, if this is important to me, and like you were saying with your husband, how do you show up? If my value is this, how do I show up differently? And what a refreshing place that is, because it's so in the presence of, how do I show up differently right now, rather than how do I churn about my regret of the past,
Mm-hmm.
or my wanting to avoid the most difficult part of the present.
Mm-hmm.
Yeah, I love that. You mentioned, as we were starting, process based therapy. And how does that get integrated in your ideas related to ACT?
Well, I think probably for listeners hearing the word ACT, and you already are showing that you've done your homework, that you're calling it ACT, because most people call it ACT.
Oh, is that
And
right?
yeah, and it is pronounced ACT. That's, but there's there's a bit of like, oh boy, another acronym. Now we have ACT, and then we have CBT, and then we have IFS, and then we have MVC, and blah, 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 blah. Like, it's a word salad, like acronym salad, alphabet salad, whatever. And
Therapists love acronyms.
oh, therapists love them. And then we have protocols for
Oh,
all of
yes.
them, right?
Yes.
And most therapists, at least the ones that I think are behind the scenes, are not just doing one protocol.
Right. Right.
Most therapists are really tuning in to the individual needs of their client, to their own strengths and, creativity in the moment, to what's needed here. And they're applying maybe principles that work from lots of different places
Mm-hmm.
in an integrative way. So process-based therapy is Steve Hayes, Joseph Sorochi, and others' attempt, and I'm sort of part of this, although I'm building the boat in the water too. Like, I don't really fully have. I'm an expert status that has no expertise.
I gotcha. Gotcha.
But we're kind of looking at, okay, what is this bigger umbrella where all of these acronyms could sit at a big round table and have conversations with each other about.
Mm-hmm.
And the bigger umbrella is like getting out of the battle of like, I'm EMDR, I'm IFS, to like, well, wait a minute, there's a lot of overlap here. We're
Exactly.
using different words for sort of the same thing. So if
Mm-hmm.
something like acceptance, if you were to talk with an internal family systems person, they would be like, oh, acceptance. Okay, we're working with listening to all the different parts of you and
Right.
having them have conversations with each other, right? And then somebody who's like a psychodrama person may be acting that out, like, let's bring your eating disorder into the room, and then let's bring your inner critic into the room, and have them, and your inner father into the room, and have them have it out. And then somebody that's maybe more somatic person maybe like, okay, let's look at where you feel that in your body. You know, where is it? Can you be with that feeling? They're all working on the process
Right.
of acceptance.
Mm-hmm.
So it's starting to see that we're kind of you know, that the parts of the elephant metaphor,
Right.
like one person's holding the ear and one person's holding the tail and one person's holding the leg and we're all holding the elephant, that we're kind of all holding an elephant together in therapy, and we just have different names for it. And how can we communicate with each other in a way where we like all are welcome, and that
Mm-hmm.
you don't have to put yourself in quite a box. Part of process-based therapy is also really trying to I don't know, I'll use the word dismantle
Mm-hmm.
the DSM,
Mm-hmm.
and trying to look at, like, actually, rather than putting people in diagnostic boxes, we can look at, oh, what's going on here with, like, maybe there's some rigidity in thinking, or maybe there's, you know, the process of acceptance or self, or all these different things are happening for somebody that we don't necessarily have to pathologize
Right.
or put into boxes. And so there's a
Mm-hmm.
whole side of that. But
It's
it's
so important, isn't it?
yeah,
Because the DSM, it's so interesting when you really train as a psychologist. The DSM, really, what it is a list of symptoms that come together to form an aspect of somebody. But it isn't and then we're calling that a disorder. And what we're talking about, I think, here is instead of pathologizing, is exploring what are the defenses and what are you protecting and what's important to you and how is that showing up in your body and your
right,
mind, and how is it showing up in your system, and how is it showing up in the environment and that you're in.
yeah,
And so it's a much more healing process, isn't it?
yeah. When I was in graduate school and I was doing a randomized controlled trial on DBT for bulimia, and it was DBT with appetite awareness for bulimia, and it
Mm-hmm.
was supposed to be this 12-session model where I mean, I'm like this like PhD student. Every single session is outlined, you know, what you're supposed to do in session 1, 2, 3, 4, protocoled, right? Because that's how we
Right.
research these things. And you'd be like on session 3 with somebody who maybe they were coming in because they were struggling with bulimia. In session 3, like their grandfather dies.
Mm-hmm.
And are we supposed to, like, in this, like, tell me about your appetite, your hunger and fullness this week? Or do I need to go somewhere else here? Like,
Right. Can I be present with you and what you're
yeah,
experiencing?
yeah.
Yes.
So a lot of these protocols that you know, have been in these boxes of manualized therapy really put straight jackets on therapists, and we
Mm-hmm.
need to be able, and also ignore all sorts of contextual things that are
Right.
going on, right? So
Mm-hmm.
so that's what process-based therapy is also attempting to kind of blow up out of the water a little bit, and give you a little bit more room to
Mm-hmm.
you know, see the bigger picture for folks and help,
Right.
you know.
And use the different resources, right? The training that we may have in embodiment or in IFS. There's so much of what we've talked about with ACT that's completely in line with what part of you is showing up and what part of you is protecting another part.
Mm-hmm.
And to be able to integrate it in a whole process model rather than am I doing it right, but I'm really being present with the embodiment with the person. And when you said earlier, when I said, so I'm in the kitchen and I'm having these thoughts, but you're like, you're not standing there going through the steps, right? Um, when you said, no, I hope you'd have an
Wait, you
embodied
froze on me.
experience
Wait,
and that you've been
wait, start.
practicing.
Go
Uh
back.
oh.
Just go back to when you said when you were in the kitchen having those thoughts. For some reason, you froze. Yeah.
Okay. Uh oh. AT&T. Got to get to Google. I think. Um, so when I was in the kitchen and I was saying that I would, trying to walk through the steps of ACT, and you were like, "Now, I hope you're not standing there right then trying to remember. Wait, what step am I on, and where am I?" And you said that it would be an embodied experience. If a listener's out there really feeling in tune to what you're saying, what would you recommend? How would they go about developing and honing a more of an embodied experience of ACT, or as you said, process-based therapy as you go along? But how would one gain knowledge about how to embody the ACT principles?
Well, it depends on if you're a therapist and you're wanting to
Hmm.
work with clients, or if you're wanting to do this for yourself.
Yeah, let's start there. If you're a
Yeah,
therapist and you want to get more training in it, what would we
yeah,
do?
yeah. So there's lots of trainings in ACT. There's live ones. I do a retreat every fall in Arizona, and I'm also a yoga teacher. So I always bring in yoga, and it's a beautiful retreat center in Arizona because
Mm,
I believe that therapists shouldn't necessarily have to go into cold, over air conditioned hotel rooms and sit at tables for hours on end
love
and feel
that.
like their bodies are in pain upon return and that they really didn't get any break. So this is a way to for me to really live out my values
Hmm.
of tending to the whole person. So that's a retreat that I do in Arizona through PESI. I'm also doing a boot camp with Steve Hayes, which is like for those that just want to learn it from,
The
grind it
source.
in from the source, the founder, co-founder. That's in DC. I don't think it's up yet, but that will be in
Okay.
DC in the fall as well. But then I also have online, not for CEs, but I have for the general public, just a walking through the 6 core processes, a Foundations of ACT course that you can do on demand on your own time through my website, drdianahill.com. And that's kind of sweet because if you're a therapist, you get handouts and all that kind of stuff, but you also get to do it on yourself. Um, if you don't have a lot of resources and you want to do a deeper dive into ACT, there's a $20 audio course that I did through Insight Timer.
Oh, wow.
And it's really kind of like a nice walking through the 6 core processes. And then any of my courses, if you don't have resources, just contact me and I can help get you connected. Not to the ones that don't belong to me, like PESI, but the ones
Right,
that
right.
do.
That
I'm
do,
happy to
right.
share those with folks that want to learn more. And then, yeah, the book, the Act Daily
So,
Journal.
yeah, say a little bit more about the book again. And you also are working on another book right now,
Yes.
which you may or
The
may
Act
not
Daily
want to
Journal.
jump into.
Yeah. No, no. How much time do we have here, Anne? The
Uh,
Act Daily Journal is about, it walks you through the 6 core processes. You learn one at a time. It
mhm.
breaks it down into bite-sized pieces and you try it out in your life. So they're exercises that I would do if you were my client. But not everyone can get to therapy, has time for therapy, or can afford therapy, or wants to go to therapy, or needs, so
Right.
it's a self-guided way of working through those processes. And then the book I'm working on now is like my own version of a bigger zoom out, which is called Wise Effort. I've gotten really interested in energy and where we're putting our energy, our prana, our life force, our elan vital, our susu. There's all different words for energy in different cultures and different traditions. And really, this like that we have a life force that we exchange with
Hmm.
each other. We exchange with nature, and how are you using your energy, and are you using it in ways that line up with your values, and what is restorative and regenerative energy,
Mm, hmm.
you know? So like spending this hour with you and talking with
Mm,
you is regenerative to me, even though I'm quote
yeah.
working, right? And I could spend
Hmm.
another hour talking with another person where it wouldn't feel regenerative. It would feel like it just completely drained the life out of me. And there's ways in which I'm showing up and you're showing up that's contributing to that. Um,
Hmm.
and there's choices there, right? Like how we put our energy into places that matter to us, and also how do we enjoy the good that's here, that's available right
Right.
here and right now. So that's what
So it's
that book is about.
so it's about
Wise effort.
paying it. Why is that? It's about putting. Well, and this is a little bit about what your podcast is too, right? Like
Mm-hmm.
that. That's the generative, and it's like how do we put our energy, like really tap into the. I like what you're saying, the vibrance of our energy, right? Because it's always, how do we conserve energy and not use too much of it? But what you're saying is what's regenerative and what's not is sitting on your phone scrolling most minutes of your free day. Does it, after you finish that, do you feel a perk? Do you feel it regenerating you, or do you feel it more draining? So what you're talking about is kind of looking at our energy sources and being more aware of it and putting your effort in a wise place as you notice those things that are in line with you and your value and your energy.
Right. Because a
Yeah.
lot of what drains our energy is getting caught up in our heads and our
Mm-hmm.
stories. It drains
Mm-hmm.
a lot of energy to avoid
Oh,
things.
really? Yeah.
It drains a lot of energy to stay attached to I am this, whatever, you know, and there's wiser ways. I mean, I just think about kind of zooming out. I mean, just thinking about our planet, right? That really
Mm-hmm.
we need to change our whole paradigm around
Mm-hmm.
energy
Mm-hmm.
and
Yeah.
around resources,
Mm-hmm.
right? So it's looking at that on sort of a more personal level. So then you can also maybe have an impact on in a bigger way as well.
Yeah. If we just, that's powerful. If you just stop for a second to think, what actions are we taking that are regenerative and restorative to our environment versus depleting? And we all really kept our focus on that. Think of the difference in the whole energy of the whole bodied system.
And often
Mm-hmm.
when you do it, when you think about that and you start working in that way, it regenerates you too.
That's
So
very
it's
true.
not so separate. This is
Mm-hmm.
indigenous cultures have known this for a very long time. That it's not so separate. It's not like I'm over here like going to my yoga class and doing my self-care activities and then I come back and I'm like good. Like that's all great.
Right.
That's all great. But also are there ways in which you could be caring for yourself, regenerating your energy while you're also giving and
Mm-hmm.
regenerating the energy of others? And that looks different. It's like lots of different ways. I mean, for example, this podcast, right? I hope it's
Yeah.
energizing for you, Anne, and your book, and these things that really come from your values and from your heart and from what's exciting to you, but then also feeds everybody that
Mm-hmm.
receives them, energizes them, and then helps them go out in that ripple effect. One seed, many birds,
I
and
love that.
that's what I think wise effort is really about, that we can tap into lots of different
Mm-hmm.
ways: wise expression, creative expression, wise relationships, wise communities, wise leadership.
And I love the look of the energy force. Like when you talk about the work, and I get that sense from you as well. And that is, people will often say to Sue and I, how do y'all work so hard? Why do y'all do that? Like, why
Mm-hmm.
can't you just slow down and just enjoy things? And I'm like, but it is work. I mean, yes, putting on a podcast is a lot of work, and writing
Yeah.
a book, we know, is a lot of work. But you're right. If I stop to think of the energy with which it comes through me when I'm doing it, it creates a lot of vibrancy. It doesn't feel like work. It feels like co-creation with others. It feels like
Right.
it feels very regenerative. And so I'm going to want you to come back on the podcast when you finish your book, and we need to really, I would love to talk further with you about it.
Yeah, I would love that. I probably will be citing your work in the wise relationship section. So
Well,
it'll be
that's
good.
it's
Yeah.
okay. That's really why I wanted to have you on. That's how I felt like when you were asking me earlier to say no. And I'm like, I can't say no to that. That's why I wanted to have you on the podcast. I loved your energy, and I loved the way you think so systemically inside yourself and other people, and to think about all of us in Mother Nature working as you described your family, right? The two hands, the two arms, and the two legs. How is our family system doing? And I just think about this upcoming election period, right? And if we could think so much about putting wise energy together about ourselves as a system, if we're only critiquing and saying negative and negative and negative about our left hand and thinking that our right hand is dominant, like if my perspective and my policy, my side of the equation is right and yours is wrong, we're not working as a system.
Yeah.
And so I'm going to hold that idea that you talked about your family as being all part of one integral system,
Mm-hmm.
and how much if we can all think wisely for one another, what a difference that would make.
Yeah, there's a simple practice that can help with that, which you could use with the election or with your ex or whoever it is you want to
Yes, tell
um,
me.
do this with. And it's just sort of a 2-column list. And on one side you write unwise effort, and on the
Mm,
other side you write wise effort. I mean, we don't have to go into the definition yet of what wise or unwise effort is. You know it in your body. What is
right.
unwise effort here?
Mm-hmm.
And what are the things that you do that you're engaging with that is an unwise use of your energy?
Mm-hmm.
Depletes you, drains you, gets all tangled up and tight and moves you away from your values. And then what are the things that you do that are wise effort? Open you up, make you feel more spacious, make you feel energized, make you feel like you want to get moving in the direction that matters to you. And it's specific to everyone, but if we all could get more on the wise effort side of things,
Exactly.
there would be a nice momentum in the right direction. So it's a little simple thing you can do, whatever place you're feeling
I
a little
love
bit
that.
tight
That's a
in.
great example. I'm going to do that related to this whole upcoming year. Well, and so you mentioned earlier, but just as we're closing, how would people find you again and all the great information about your books, etc.?
My website is drdianahill.com. There's a newsletter there you can sign up for if you want to hear from me on a 3-ish, weekish basis. I'm not super rigid about that, but that's a great place to sign up to hear about all the things that I'm up to. Why at drdianahill.com.
And then your podcast is Wise Effort.
Wise effort.
Yeah, check it out. It's really, I just love, I've listened to many episodes now and have really found it enlivening and helpful. So highly recommend.
Thank you.
All right, Dan, thank you so much for joining us today. And yeah, if those of you out there that enjoyed it, check out her website, check out her books as well. And please take time to rate and review. That's always really helpful. And send this episode out to somebody that you think could use it. All right. Thanks so much for joining us, and we'll see you around the bend.